Hello, my name is Shelby. I am the OT student that will be working with you today. Your name is Mrs. Stroke, is that correct?
That's correct.
Okay, Miss Stroke, can you please tell me your birthday and today's date?
My birthday is 1/31/97. Today is 10/29 of 2020.
Okay, how are you feeling today?
I have a little bit of pain in my lower arm.
Okay, I see that you acquired a proximal humeral fracture 4 weeks ago. How did you acquire this injury?
Well, it was icy outside and I fell with my arm outstretched, and I've had pain ever since because apparently I fractured it.
Okay, we'll take a look at that and try to come up with some activities that will decrease pain and accommodate for your injury. I see that you experienced this fracture 4 weeks ago. Your physician chose the non-operative route, which requires you to wear a sling until otherwise noted. There are some precautions that you need to be aware of during therapy before we begin. I don't know if your doctor told you this, but you cannot internally rotate your shoulder like this or extend your shoulder like this until 6 weeks. You also need to be able to wear your sling at all times, even at home. You can take it off while you're in the shower, and you can take it off while we're doing exercises in therapy. Do you understand these precautions?
I understand. Are you sending me home with any paperwork?
Yes, I have some pamphlets on all your precautions, and then later we'll talk about some exercises that you can take home and do.
Okay, sounds good.
I'm going to do a quick evaluation. It's just going to be a couple of questions asking about your activities and your home life and your home situation. First, I'm going to start off with on a scale of 1 to 10, what is your pain level today? 1 being you have a hangnail on your finger, and 10 being you got hit by a truck.
I'd say my pain today is around a 7.
Okay. Are you right-handed or left-handed?
I'm right-handed.
Okay, that's good. So has this injury limited your range of motion and strength in your daily activities?
Yes.
Okay. What activities have been affected?
Well, having pain and low movement in my left arm makes it hard to put a shirt on, and just to lift my arm. So I always have to have help dressing my upper body. It also has affected my ability to cook independently, do the laundry independently, and just complete other household activities by myself without the help of my fiance.
Okay. What home environment do you live in? This might include the number of people you live with, stairs in the house, or if the house is just 1 story, if there's a difficult layout of the house when it comes to angulation, if any of your appliances are hard to get to, hard to reach, or hard to use with one hand. And I also need to know the layout of your bathroom for bathing purposes.
Okay, well, I live in a 1-story home. I currently live with my fiance, his parents, and 2 dogs. My bedroom is directly across the hall from the bathroom. It is a shower tub combo, but we have a handheld shower head in it. And my toilet is regular height. And we do have a dishwasher in our house. And my washer and dryer are front load, which is helpful because I can sit on a stool and load and unload the laundry if I'm fatigued.
Okay. Are there any environmental or social issues that have been affected due to your injury that we'd be able to work on?
Yes, my ability to drive, because I'm having to drive with my right hand because my left hand is in pain, and this causes my right hand to easily fatigue, and then my left hand fatigues even quicker, so I'm just struggling. I can't drive very far.
Okay. So now that we have some more information about your daily activities, I need to measure your range of motion. For the purpose of this video and timing, we have already measured range of motion, but I will discuss with you how you would measure it based on the muscles and the different points of the bone to be aware of with using the goniometer. I will tell you that normal active range of motion at 4 weeks post-injury is about 140 degrees, and she was able to meet that. We won't measure extension or internal rotation until after 6 weeks post-injury. So this is the humerus. on the left arm. Typically I'd be using some gloves, but we don't have any with us here today, so I apologize. So when measuring for flexion, you want to palpate on the shoulder and come to the distal end of the scapula and palpate for the acromion process. And with this injury, the break or the fracture is going to be in the proximal humerus, so you want to be aware of the pain and pressure points so you can avoid that while measuring range of motion. You also want to know about the distal end of the humerus to line up the stable arm of the fulcrum. For muscles that you will need for flexion is the anterior deltoid, middle deltoid, and you won't use the posterior deltoid for this. For abduction and adduction, you'll use the rotator cuff muscles, and then for stabilization, you use the deltoid and the pectoralis minor and major. And the rotator cuff muscles are the supraspinatus, infraspinatus, subscapularis, and teres minor, and they were all on the scapula back here. So during this evaluation, I will also use the rehabilitation frame of reference and the adaptive frame of reference. For further evaluation on measurement, we could use the COPM or the MOHO to evaluate performance measures. Is this okay with you?
Sounds good.
So we know about the different home and environmental activities that you struggle with, but to get down to other activities that are more specific that you might not have thought about, we were going to do the dash. So here is the quick dash. In this video, we're not going to do the whole thing. I'm just going to touch on the more important ones at the top, and then you'll be able to see this document at the end. So in the top portion, it asks 6 different questions, and then it rates it 1 to 5, 1 being no difficulty and 5 being unable. So when opening a tight or new jar, are you able to perform this activity?
No, I'm not able to.
Okay. Are you able to do heavy household chores, which includes washing walls and floors?
No, I'm not able to do that.
Okay. Can you carry a shopping bag or a briefcase?
Nope.
Can you wash your back?
I can with my unaffected arm, but it's pretty hard to do with my affected arm, so I wouldn't be able to with my affected arm.
Okay. Can you use a knife to cut food?
It's pretty difficult.
Okay. For recreational activities, which you take some force or impact through your arm, shoulder, hand, this includes golf, hammering, or tennis, etc. Are you able to do any of these activities?
Nope.
Okay. That concludes the first portion. There are other portions. And then for the symptom score, use the sum versus the number of questions. And you can figure out that. And then we can do this again at the end for reevaluation to see how far she's come. So now we'll discuss some exercises we will do during therapy. Before starting therapy intervention, we'll use a hot pack for 10 minutes. With this hot pack, we'll have 6 or 7 layers in between just to prevent any burning, because you just want that heat there to increase your blood flow, and then that will help with healing and pain. And it'll get your muscles going, so when we do these exercises, there will be less strain. First, we'll begin with a pendulum exercise. When you circle in and out, we'll just have you lay face down prone on the table and hang your arm out and just do this, or you can do it standing too. We'll do some soft tissue mobilization. We'll do a supine external rotation with a stick at a 30-degree angle. We can also do some supported elbow flexion with something very, very light, like maybe your phone or your water bottle, something that's less than 2 pounds. We can also do some shoulder abduction exercises without full range of motion with the scapula stabilized. You can begin shoulder flexion and elbow extension exercises by moving a towel on the table back and forth like this if pain is tolerated. Perform placing a plate in a microwave at counter height instead of reaching up too far. Perform placing laundry in and out of the washer and dryer. We'll also do some folding. We can incorporate that in your goals. We can also practice brushing hair with one arm and driving. So, do you have any questions about that? And I'll give you a pamphlet on how to perform these exercises.
Okay.
Since you have no sensory issues, you can use a hot pack at home or a cold pack. During therapy, to help decrease pain, we'll use the E-stem for 15 minutes. To use E-stem, we'll place the probes here on the anterior part right above your fracture. We will not use E-stem if you have venous or arterial thrombosis, or if you have any tumors or impaired sensation or skin irritation. We can also use ultrasound, which is where you place gel here, and I'll use a probe to move it around, and it increases blood flow and cell growth and like bone regrowth for healing. Sorry. So now it's time to create some therapy goals. Do you have any specific goals that you would like to meet?
Yes. I would like to be able to put my shirt on and take it off safely. I would also like to be able to fold laundry, cook, clean, and bathe independently if possible.
Here are 4 of your goals. They will revolve around: patient will perform 3 shoulder exercises a day for 30 minutes to increase strength and range of motion. Patient will don and doff shirt with this minimal assistance without external or extension of the shoulder to increase independence when dressing, and we can also use some adaptations for that. Patient will use lightweight handheld shower head while standing in the shower to increase independence when washing. Patient will wash, transfer to dryer, and fold 1 small load of laundry with minimal assistance to increase independence. How do these goals sound?
That sounds fun. How many times do I need to come to therapy a week?
I'm requesting that you come 2 times a week for 6 weeks, and the timing that you come will depend on your insurance plan. I'm also requesting that you get a physical therapist so they can help you with strength and range of motion, and we can focus more on your ADLs. After 6 weeks, we will reevaluate to see if you need more therapy to work on internal rotation and extension. It's been a pleasure working with you, Ms. Stroke, and I can't wait to see you next week.
Okay, thank you.